Welcome back to The Blend. If you are over the age of 65, chances are the conversation around Medicare is of interest to you. From different plans to cost to prescriptions, there are so many questions to ask.
That's right. Here to break it all down and help you stay healthy and save money is Gary Denning from United Healthcare. Great having you back, buddy.
Thank you. It's great being here.
Hello.
So I only seem to think about Medicare during open enrollment time, but we should be thinking of Medicare as right now as well and thinking about our coverage.
You really should. You know, millions of Americans had the opportunity to choose their health care coverage in the fall during open enrollment, but what we want to emphasize is that right now is the time to be proactive, to make sure that you're getting the most out of the plan. And so for us, it comes down to really 4 C's: coverage, cost, care, and convenience. So it's very important that we really focus on those and that you get the most out of the plan that you've enrolled in.
Okay, great. I understand those 4 C's. They sound very valuable. How do we get the most out of our plans? How do we do that?
Right. Well, you first want to look at coverage. It's important for you to know what plan you have and what that includes. So, for example, individuals that have Medicare, straight Medicare, A and B, you have an annual visit that's included, as well as some preventative screenings like cancer screenings. So go get your annual physical and do those preventative screenings. Early detection is so important. But for individuals that have Medicare Advantage, you have those benefits plus additional ones, things like dental, hearing, vision, even gym memberships and wellness programs, over-the-counter benefits.
Isn't that great?
So all of those things can also help you stay active and healthy and, you know, just enjoy your retirement years.
It's interesting because part of it is just knowing what you already have included and taking advantage of that.
And I think the whole thing can be a little bit confusing, which is why you're here to kind of clear up any of the mystery.
That's right, and to help people understand that you really need to be proactive. Go pull your policy out, see what exactly is covered in the plan, and take full advantage of that.
There's Medicare and then there's Medicare Advantage.
That's right. So straight Medicare is parts A and B that most people are familiar with. Part A covers hospital care, B covers your doctor visits. Medicare Advantage plans are those plans that are covered by insurance, private insurance companies, and include parts A and B, but also have a prescription drug plan coverage and those additional benefits that we already talked about.
Yeah.
Great. Gary, for people on Medicare who are living on a fixed income, you know, they want to be aware that they are planning for their health care.
Right.
Any tips on how folks can do that?
Yeah, costs, of course, vary depending on the individual and the plan that they're on. Those who have original Medicare, for example, only get 80% of their costs covered for their medical expenses. So the 20% is on them, and they have no maximum out of pocket.
Wow.
With Medicare Advantage plans, there is a max out of pocket and predictable copays. And so you want to plan for that maximum out of pocket. Once you reach that amount, you're going to be covered at 100% for the rest of the year, giving you great peace of mind.
Which is fantastic. Prescription drugs.
Yeah.
This seems to be the
important.
biggest, the biggest pothole. I mean, it's a major concern for people because the expense can go through the roof.
Right. There again, original Medicare does not cover those prescription drug costs, and so you're at 100% unless you purchase a separate prescription drug plan, which is typically included in a Medicare Advantage plan. Ways that you can save if you have a prescription drug plan like that are to talk to your doctor, see if there are some generic brands that can help to save you money, or drugs that are on a lower cost tier. And then you can also take advantage of the mail order prescription drugs. Typically 100-day supply is going to be less through the mail. If you do want to use the retail stores, many insurance companies have negotiated special rates with certain retail stores, so you want to find out which ones those are.
It might be a little bit of a hunt to find, you know, which drug for which store.
Well, it's all part of that hunt of understanding your benefits, right? It's all clearly spelled out there for you. You just have to be proactive and take advantage of it.
It takes a little bit of time to get through all those benefits, doesn't it? And really understand them. With the prescription by mail, it's very convenient because you don't have to make that monthly trip to the pharmacy.
Exactly.
As well, a lot of people are starting to do that.
Yeah, absolutely.
Yeah.
The less you can do that, the better.
And the costs are often much less because we can cut out the middleman of that retail.
No questions.
Wonderful.
You were mentioning those 4 C's. Care was one of those 4 points.
Right. So you also need to make sure that you're feeling comfortable with the doctors, the hospitals, the specialists that you're going to see. With Medicare Advantage plans, there's a coordination of care, and so everyone is aware of what care you have been getting, and it's just that peace of mind knowing that everyone really understands you and your body and how it responds to certain, medications and treatment and things like that. So care is very important as well.
Yeah, it all comes down to the care, doesn't it?
It really does.
Yeah.
And we want you to get the best care possible.
It certainly does. Thank you so much for giving us just such a lot of great information today.
Absolutely.
If people want to tap into more resources, get more questions answered, how can they do that?
Yeah, for basic information about Medicare and these Medicare Advantage plans, there's a great website called MedicareMadeClear.com. Medicare.gov is also a good resource, or calling 1-800-MEDICARE. And then to really understand the benefits that you're getting on your plan, pull out those documents, go to the company's website whose plan you've enrolled in, or on the card, you can turn it over and there's a phone number on the back. Call them and just make sure that you're taking full advantage.
Ah, the 1-800 number on the back of the card.
You got
yes, it's always there for you.
That's right.
Gary, thank you so much.
Thank you. Glad to be here.
Make the most of your Medicare plan. If you have questions, visit one of the websites listed on your screen. A number is also listed right there for you. United Healthcare is a proud sponsor of the Morning Blend.
1-800-MEDICARE. You just have to figure out which letter is the number.
I know, it takes a minute.
You're there for about 3 days.
Five.
It's awful. Hey,
Four.